And there's a lot that is very exciting in terms of TB globally and in South Africa at this point in time. We have more tools to find TB, and this is very important because we need to find TB in order to end TB. We have digital, ultra-portable X-rays. We have more molecular tests. We are about to introduce near point of care, and we have shorter treatment. Outcomes are improving. So this is very exciting. The challenge remains that we're not happy with decline in terms of mortality.
And so now we're moving towards what's called near point of care testing or point of care testing. In other words, using samples like urine as an example to test for TB, using tongue swabs to test for TB. What that means is it really empowers the healthcare worker, but it also allows the patient to engage more with what is going on. So your tongue is being swabbed and, you can see for yourself what the results are. It possibly also lends to the credibility for the patient at least of how the testing method is done. So by far the most exciting aspect for me has been the new diagnostics, and there's a lot more in the pipeline.
We have a situation in the country where we test more females overall, and we find more males with tuberculosis, which means we are missing a lot of males. Retention in care is not very good. We still have more than 10% lost to follow-up in our TB cohort. So that's a big problem. We believe that the TB vaccine is going to be a game changer. It will help us improve further. Not that it will replace what we're doing, but in order to benefit well from the TB vaccines, we need to continue doing what we're doing already and do even better. A group of people that will benefit more from all this, these are the young people. And they have to make us take it because, remember, children are infected by adults. Young people are infected by older people who have lost their strength, their immune system. They get TB, they infect young people. So this should be their fight. They should make sure we take it and we do not encourage misinformation that will make our society to be more sick and we lose more people, more resources, more money.
So we're already talking about community engagement. We're talking about financing for a new vaccine. We're talking about key population groups that we'll target with the new vaccine. So in addition to me being extremely excited about the science around the vaccine, I'm really happy that we're incorporating the entire ecosystem around that, that's required for successfully introducing a novel vaccine.
Majority of patients that are not doing well have a low body mass index. So it has something to do with their nutrition. We've seen that clearly in our MDR TB patients. TB is also a social disease. I'm excited that during this conference, the Department of Social Development will launch its plan to fight TB because we done so well in the fight against TB in South Africa, but we haven't done much in terms of talking to our people to get them understand their disease so that they take responsibility. Young people of South Africa need to take the opportunity of a new vaccine and really handle with both hands to communicate, talk to their grannies, talk to their parents, to do the right thing and decrease tuberculosis and end tuberculosis.